Welcome to the Valaura Exchange, where leaders connect the dots between health, humanity, and performance. Each episode brings real conversations, fresh perspectives, and the insights shaping the future of how healthcare leaders understand and solve today's most pressing challenges.
Medicare Advantage Star Ratings has always been about improving quality and member outcomes. But over the past year, we've seen significant changes that are causing many organizations to rethink how they approach Star's performance. Health plans are navigating evolving regulations, shifting measure priorities, increasing financial pressure, and growing expectations around member experience, all while trying to improve outcomes in a sustainable way. The question is no longer simply which measures matter. It's actually what drives meaningful improvement for Medicare Advantage performance. For those who are joining us for the first time, my name is Theresa Connelly, and I'm the Director of Business Development here at Valaura Health. I actually have a guest with me today, Andrew Bell from ProspHire, and I wanted to have him chat with us today about how to improve Medicare strategy for Stars and overall for health plans. Before we dive in, though, into the discussion, thank you so much for coming and joining us today to have this chat. Would you mind just going over a little bit of your background, Andrew, and then anything else that you wanted to share about your work with health plans, and then we'll get into the questions.
Yeah, Theresa, thank you so much for having me. I've been really excited for this conversation, so looking forward to diving in a little bit more into the crazy world of Medicare Stars. I actually started my career as a cellular and molecular biologist, which is often the very natural transition into the health plan world. I'm joking, of course. But I've been at ProspHire for almost 10 years now. And in my time at ProspHire, I've worked exclusively on our payer side of the business. And at this point, I oversee our government programs line of work. In there, we service Medicare Advantage plans, Medicaid organizations, plans offering the Affordable Care Act or the exchange. And we do a lot of work within each of those verticals, but Stars in quality and HEDIS improvements being a large portion of what we do, and certainly something I'm excited to talk more about today.
Awesome. No, that's a great overview, and it really sets the stage today for our conversation. So I guess to start us off with our first question, when you think about Medicare Advantage organizations that consistently improve Star ratings, what do you see as the biggest drivers of meaningful performance improvement for them?
Yeah, so Stars is it's one of my favorite topics, I think, for a number of reasons, but a primary one is really because Stars sits at this fascinating sort of intersection, right? It sits at the intersection of strategy, operations, data management, care management, member experience, pharmacy. It really just touches every part of the business, right? And if you think about it, the Stars program itself is really this sort of just wonderful vehicle for Medicare Advantage compliance. And at ProspHire, we've been really fortunate to work with many Medicare Advantage organizations over the past decade plus, organizations of different sizes, markets, levels of maturity. And through those experiences, we've definitely seen sort of patterns of excellence emerge. So I think a few thoughts there. The plans that truly move the needle don't just treat Stars as this sort of like quality project. They treat it as a true enterprise priority. So that means leadership really understands Stars and its impact on revenue growth, market positioning, and through that understanding, they give the program the support and the voice that's required at the leadership table. I think another meaningful driver of performance comes from just the Stars and quality leadership team members themselves. I think that the irony in Stars is that oftentimes those in charge of the program have little direct oversight over the mechanisms that impact Stars. Like, they don't negotiate provider contracts. They don't develop the data acquisition strategy. They don't develop the model of care. And in most successful cases, the Star leaders that are truly driving strong performance, they're excellent communicators, they're wonderful storytellers, and they're persuasive. And many have to lead through that sort of persuasion. I'd also say the best programs are really just ruthless at turning strategy into action. Having a beautiful roadmap and a beautiful PowerPoint deck is great, but if you don't have a team that can actually execute, then it's kind of worthless. I'd say last but not least, high-performing plans are masters of their own data. They know their members, they know their gaps, They know which measures matter most, and they understand what's actually driving performance up or down. And I think that level of intimacy with data matters because it allows people to focus and move with more urgency. Again, the plans that I'm describing aren't just sort of guessing. They're not running broad campaigns hoping something may work. They know where they're strong, they know where they're exposed, and they know which members need attention. And I think, again, that's another big separator or differentiator between high performing programs and those sort of struggling to catch up.
Absolutely. No, I echo all of those. And actually the data piece, that's huge because I know at Valaura, we see this just in general in my past life. I've seen that the data piece is critical. Like you mentioned, just well, also knowing your strengths and weaknesses, but the data piece, if you can tell the right story with the data and also make sure it's leading you to the right outcomes, that really is how these plans are able to succeed well. And they're comfortable with sharing across the organization too, like breaking down those silos. So couldn't agree more with what you mentioned. And I think those are really valuable points for health plans in general, especially even those that are entering the market from a little bit of a newer front than those that are a little more experienced per se, but very, very helpful tips. So thank you, Andrew, with that one. Another thing that we hear often is that most plans already know which measures need attention. So, I mean, we know they're weighted differently. For example, maybe it's a new measure that's getting a little more press. So we need to make sure that we're looking into it a little differently than something that's been out there before. But the challenge is really like kind of what you already mentioned, turning that strategy into day-to-day execution, not just like having a playbook and saying, this is how I want to approach it. So where do you most commonly see organizations break down between the planning and then actually delivering the results? Because I feel like that's something you've probably seen a lot of on your end, just given the line of work that you're in.
Yeah, it's a really interesting dynamic. I think at this point, I don't want to say the playbook is out there for stars, but we've been doing this program for the better part of 15 years now. So most plans, I'm not sure they really struggle with, to your point, knowing what to do. I think often the struggle is just getting it done or potentially covering that little expertise gap. One little measure trick that the team may not know about, or one little data intricacy that they need to unpack a little bit. But again, I think bottom line, like the execution is going to break down just simply when there isn't a system behind the strategy. I've walked into so many environments where there's strong ideas and well-defined opportunities, but maybe no one really knows who's owning it, or teams are just going to continue to operate in the silos that exist already. And there's no real mechanism to track progress and drive accountability, or maybe just leadership lacks persuasiveness, coming back to this idea of persuasiveness. I think this is where you need that strong quality and stars leader, someone to drive action, to marshal the resources necessary, both staff and or budget funds, and again, tell compelling stories. Coupling that with a strong stars team of change agents, people who are really interested and invested in thinking creatively, navigating ambiguity, building strong cross-functional relationships. Working horizontally in an organization is just as important as it is working vertically. So again, the most beautiful PowerPoint deck with a pretty strategy will inevitably fall short unless you have a strong system to back it up.
No, that makes sense for sure. And I know health plans, and I know you see this all the time, health plans are balancing dozens of quality initiatives at the same time. It's a big juggling act between stars, member experience, and there's like the clinical programs. And then like we already talked about, limited resources. Basically everything feels like it needs to get done and can be a priority. How should plans decide where to focus their star improvement efforts overall, from your opinion?
Yeah. Yeah. Look, I think stars at its core is sort of still a math problem that needs solved every year, right? Everyone's trying to get to 3.75 at minimum. And there are many ways to get there, right? There are many different scenarios and probabilistic scenarios that can get you to that magic number. And that's going to look different every year. So let's just sort of take that as a known and understand that understanding your math journey or your plan in terms of the numbers to get you there is always going to be and should be the starting point for defining priority, certainly across measures. But I think when we see organizations struggle, even just beyond understanding their math plan, is when they're just trying to spread efforts too broad. They don't really have a good sense of impact. chasing incremental gains. Again, I think the most effective approach is to just make deliberate choices. Again, using the math path as sort of your backbone, focus on the measures that are going to move the contract significantly and align the organizations around those priorities. I think shifting a mindset away from sort of activities, I've done 20 things, to I've moved this measure, this rate. Impact-based thinking, outcome-based thinking, that's going to help move the needle a lot more, especially when you're thinking about prioritizing effort, interventions, time, money. All of it will need a strong ROI case and a strong impact case in order to move forward with it.
No, that makes sense. I know something in my past life we tried to do a lot of too is getting the lift out of different interventions, like trying to understand. And of course, it's a little bit of a science behind it, but making sure like it's clear, like, did this activity actually lead to something within the measure, like you were mentioning, like seeing a rate change or at least influence behavior, et cetera. So that is very critical. Because I mean, the only way we learn is by evaluating our initiatives too, ideally in real time, but sometimes you have to do some retrospective too. So that makes a lot of sense on my side too, and we see that all the time. So, and I mean, you kind of hinted to this as well, and we have a lot of similar elements within this conversation, but they're all very critical. Member engagement is obviously central to improving quality performance because we do want to have them invested in their own tasks that need to happen to help keep them healthy, help them improve those outcomes that we're looking at. But kind of what we already talked about, a lot of outreach campaigns may struggle. They might not change the behavior we need. They may not produce the measurable outcomes that we're looking for. So from your perspective, what makes engagement effective in a STARS context if you were talking with a health plan and that's what's something like on your list to evaluate with them?
Sure. Yeah. That's always a critical element to tease out when working with anyone. But I think member engagement is an area where I think the industry has evolved quite a bit, but there's still a gap between sort of effectiveness and effort. And I think moreover, healthcare just broadly lags behind other industries. Certainly when I think about engagement and experience, if you just sort of take your own experiences in banking or food delivery apps or Uber or Amazon, I mean, those experiences are light years past where healthcare is now. And I think that's changing, but that's a headwind that many in healthcare are having to contend with. I think, again, with that being said, what I've seen repeatedly is that outreach alone just doesn't drive results. If you're just kind of hammering the outreach button over and over and over again, that's not going to move the needle. And I think where we've seen shifts and what matters more now is your outreach targeted? Is it coordinated? And is it designed to actually change behavior? There's a lot of really interesting work happening in sort of the behavioral science, behavioral economics world that I've seen tied into a lot of different plans today. And I also think the plans that are getting it right, they're using data in a more sophisticated way than ever before. They're identifying the right members at the right time with the right message and the right channel. And they're coordinating across the whole spectrum of people involved here, right? Coordinating with the outreach teams, the provider groups, your pharmacies. And again, I think it just becomes less about volume and more about precision. I can't tell you how many spam phone calls I get on my cell phone on a daily basis,
That makes
or
a lot of
spam
sense.
text messages. I just think
Sorry,
that sort of the instinct to flood will be dwarfed by sort of your upside on precision. And again, I'd be remiss without mentioning sort of AI, right? Like there are a litany of interesting use cases with AI as it relates to engagement and experience. Using artificial intelligence or voice automated phone calls, AI agents to really make sort of bespoke or unique member experiences at an individual level, I think is a really interesting, it's a really interesting thing that plans are thinking about right now. And it's fun to be at the forefront of that with a lot of our plan clients. I don't know about you, but I've heard many demos of these sort of AI voice automated calls. And I think it could probably fool me soon, knowing if it's human or AI, which is maybe more scary than anything, but certainly an interesting opportunity for plans.
No, I agree. Yeah, actually, I know I've tested a few of those. It's kind of surreal because I mean, I've tested it over a couple years too. So seeing the evolution, like you said, like kind of how it started being like, okay, I can kind of tell. And then if you really take yourself out of the picture and truly listen, like it could come off of fully like a human conversation. Everything's going on just as it should. And they're even checking when they should, reading sentiment. So it's a little surreal to me too. But I like what you hit on where you're talking in general of like making sure that you're mixing between a balance, like making sure that there is that technology out there, but of course we're still protecting like the HIPAA data and all the patient information, and then just making sense of how to scale AI in a responsible, like governed way, which is huge because you can use it in a lot of great ways. It's just with healthcare, I agree with you. We have to be a little more careful. So I do think that's probably, like you said, a little bit why it's a little harder to advance healthcare as fast as like the other fields, just because there are more check boxes we have to go through. But I have seen it myself too, like you said, some of those changes. So all really great points. Thank you for going through that with us. So I guess like as an organization, when they're like improving their engagement, another theme that I've heard a lot, and I would assume you have too, is, and you actually already mentioned it, accountability, right? Like just figuring out like who is responsible for what. And it's not really just one place anymore. Like it used to be like they did have a quality or stars team. That was your point person. And it's not that they're not anymore. It's just the coordination like across the teams is what's really needed. So like from what you've seen in the field, I guess, if you want to call it that, what kind of operating model or governance structure do plans need to make sure that stars improvement is a year-round discipline, not just like scrambling at Q4 or even Q3 whenever the scramble happens, which I know will still
Yeah,
happen, by the way.
The Q4 push, I think we should ban that word.
Yes.
Yeah, look, everybody, I don't care what anyone says, everybody hates more meetings, and I get that. But I think from our lens in stars, I don't think the answer is just fewer meetings as much as it is better meetings. Stars is a highly regulated, highly matrixed, highly intricate program that involves all layers from the CEO down to the call center staff involving and operating. You have to have discipline and governance and accountability layered into that, full stop, given its coverage and its scope. You need the right stakeholders, the right decision makers, and the right information at the table. Again, like how many of these meetings have we been on when one person talks and there's 100 people on the call? Like, I don't know what the point of that is. I think it's important to really understand too, just the level of audience, or like understanding what altitude are you operating. If you're operating at a 30,000 foot altitude, you're likely dealing with the CEO, the CFO, the COO, an executive team. They require something fundamentally different than, say, an analyst or a member of the call services team, right? And I think understanding what altitude you're playing in is vitally important for any strong governance or accountability model. Again, I think executives, if you're thinking about sort of altitudes, executives need to understand things like, where am I investing my dollars next year? Or what can I expect my revenue to be next year or the year after that? That's a very different conversation from, say, on the stars team itself. Who's owning this initiative? What's the status? What does success look like? What KPIs are we tracking? Again, just very different sort of audiences. So I guess to sort of sum, good governance is really just about consistency at every altitude. It's about having the right conversations with the right people at the right time with the right level of detail. And I think when organizations get that rhythm right, stars becomes less reactive, less reliant on scrambles, and a lot more manageable throughout the year.
I like that. I actually really like your allusion to the whole thing about altitude. I think that's going to stick with me because I basically channeling up or down how you're going to explain the whole program essentially to your audience is huge. I agree with you because I've been in a meeting where maybe it's been misunderstood, like first, who's accountable? That's a big one. But then also like, how do I actually interact with everyone like on the call and ensure like they're actually having solid takeaways or like they're adding to the conversation versus like the C-suite, maybe it's you actually reporting out to them versus having to like get some buy-in, for example. So it's just really channeling that up or down. I like that saying that you threw out there. So I think I'm going to steal that one for the future.
Feel free to steal it. Take it.
Okay. done. But for for being able to get everyone on the same page, I will admit, I think that is probably one of the biggest struggles, at least that I've seen in real life. Like when I've been on those big meetings, like you mentioned, if you have a couple people speaking, but no one else is really not even intentionally able to speak up, it's just kind of evaluating your meeting structure too, which I think is a really tangible thing for health plans to think through if they're not there already, which I'm sure most of them out there are. It's just maybe having a reality check and just seeing like, hey, am I actually performing how I should be when it comes to just meeting organization in general? So that's huge. So thank you for that. So another part of the conversation is deciding when and also how to leverage outside expertise. Many plans rely on vendors, as we know, technology partners. They might even be a consulting organization such as yours to support quality initiatives. So how should they evaluate whether these resources are actually helping them? If you have any advice there.
Yeah, look, I mean, many plans today leverage a range of external partners in technology solutions, which I think absolutely can be a strength. Every plan leader that I talk to they're talking about outcomes. I'm seeing more at-risk contracts and more explicit sort of ROI models tied to investments more now than ever. I think it makes sense, right? With rate pressure, margin pressure, cost trends going the wrong way in all lines of business. Plan leaders are obviously just more judicious with their funds. And I think the plans that are getting value from partners are just a lot more intentional, defining expectations upfront, aligning if it's a specific measure you need help with, or set of measures or certain KPI criteria, being very explicit, and then ultimately integrating them into your broader operating model. And I think what plans shouldn't do is sort of onboard a vendor and then kind of kick them to the side. If you're going to spend the time and money and investment to partner with someone, truly bring them into your fold, because ultimately it's going to benefit everyone. Certainly the plan, also the vendor partner, from being a part of that collaborative model. I'd say the other thing that is an interesting trend that I'm seeing more and more of is this idea of vendor stacking. It's hard to understand exactly where you could be having holes in terms of vendor performance or technology performance or measure performance. And a lot of the plan leaders that I'm speaking to are more interested in intentionally stacking vendors, or at least just have a more broad array of partners doing slices of work, not the whole thing alone. And so in the end, you have a collective group of partners all contributing to an overall goal, providing a lot of cross coverage across the totality of the work. So I don't know, in the end of the day, any given health plan can't do every single thing on their own required to succeed in stars. They inevitably will rely on vendor solutions, technology solutions, or expert consultants to help. And it's going to be up to us on the consultant or vendor side to deliver on the value that we promised and ensure that our clients are successful.
I agree with that. And I think too, like the transparency part and making sure that you really treat it as a true partnership, like you were mentioning, that's huge. When the vendor or the consulting firm is actually brought in, like you said, and incorporated like truly in the ecosystem, I mean, that's the best way to learn and also be able to help the patients that they're likely going to be assigned or helping if you're a vendor solution, for example. So I think that's really valuable information. And the shared risk part too, I completely agree. Because I mean, we know that there's a whole purpose. If we're defending something that we're able to produce, we should be able to be willing to go at risk for it because we believe in the product and know it will work and help bring an impact. So very, very helpful advice there. So kind of going towards some of the last few questions that we have, as we look ahead to the next star cycle, health plan leaders are making very important decisions that are going to shape their future and performance. So if you were advising a Medicare Advantage plan, their leadership team today, what are the top 2, could be 3 actions that you'd recommend that they'd prioritize to improve STAR's performance in a sustainable way? So like something they could hopefully repeat or be able to continue with and hopefully have a legacy of in the future.
Yeah, I love this question. I have a lot of thoughts. I'll stick to 2 though. So if I were sitting with that Medicare Advantage leadership team today, I would be pushing them to think hard, really hard, about whether their STARS program is built for where the industry is going, not just where the program and where the industry has been. And I think taking a really hard look in the mirror to evaluate and assess current capabilities, competencies across the full spectrum is required. We've seen all the headlines. We've read about all the lawsuits. We understand that Stars as we know it is ripe for change, real change. And again, I'm not just talking about silly sort of measure weighting changes. I'm talking about fundamental change. Stars will exist in all likelihood in some form or fashion, either as a quality tool, a compliance tool, a mechanism for holding plans accountable. That's not going to change in my view, but it will almost certainly not look identical to what it is today. And that's why I would reiterate to plan leaders to think about where the ball is going, not just where the ball is today. And so I think with that being said, the first major area for me and for a lot of the work that we've been doing at ProspHire is digital quality transformation. I think plans need to take this much more seriously. This is something that we at ProspHire have been talking about for a long time now and educating our clients on. And I don't mean just treating this as a technology upgrade or a data connectivity project. That's a part of it, but it's not the whole story. Digital quality and the changes from NCQA and the HEDIS changes more broadly are going to change how quality teams operate and how quality is managed, full stop. It's going to change workflows, roles, responsibilities, staffing models, how you engage with providers, and just the way that plans identify and act on performance gaps throughout the year. The plans that understand that this change is significant and it needs to be treated like an operating model transformation, not just some technology project, are the ones that we're going to be put ahead. And again, this is fundamentally changing the game. Plans moving away from that heavy retrospective review, the chart-based model, towards that continuous, near real-time, if not real-time, sort of performance management view. This is big. The second piece, we had this conversation a little bit when we were talking about member engagement, but the second area is just AI adoption and enablement. I don't think the speed of change in the AI landscape is staggering. Like, we're not talking about months of transformation. It almost feels like every week something is changing. A new chat or Claude model comes out every week. And I think that plans should be having a little bit more of a serious conversation about how can AI make the organization better, faster, stronger? Sure, but think about it through a practical lens. Where can it help us identify the right members faster? Where can it make call center teams more effective? Asking all these use case questions should be top of mind. And to me, those are the two biggest areas that plans should be focused on now: digital quality transformation and thoughtful AI enablement and adoption. Stars is only getting more complex. It is ripe for change. And the winners long-term are going to be the ones who are able to modernize their capabilities and modernize their operating model, not for what works today, but for what will work in the future.
I like that. It goes with the whole theme of trying to stay like on top of and be proactive best you can too, right? Because it's not that you're trying to guess. You do see essentially a roadmap, like you mentioned, of where things are headed, and there's a lot of things changing quickly, even as we speak. So I think that that's great advice. And I mean, imagine the things that you can do with AI. There's sentiment tracking that you can do to help improve the experience of the phone calls. There's even ways to just help improve the efficiency of documentation. Maybe it's not like taking over the tool, but like becoming more efficient so you can reach more members, et cetera. So both of those points are very important. So I agree with you.
Here's an interesting thought that I know every Stars leader will understand, right? At any given moment in time, a Stars leader should be thinking about 3 concurrent Star years, right? Take for today, for example, we're in July of 2026. At this moment in time, you're focusing on measure year 26, your full-throated effort and thought and energy. However, Plan Preview 1 and Plan Preview 2 is coming up, and that's from last year. And what happened with Clover and calculating ratings, you're still thinking about the past. And at the same time, you just submitted your bid in June, and you're already thinking about your budget for next year and what measures are being introduced into the program. And the complexity of the Star cycle is, I think, just sort of this beautiful, intricate like dance. And people who can understand and operate at all 3 of those different levels simultaneously are always going to be the ones who win.
I like that. I guess that's why I'm always like, is it MYCY we're talking, like Medicare coverage year? Are we talking star year? And you're
Yeah.
right. It's just, you constantly have to, actually, that's the first thing you probably should do is aligning on what are we exactly talking about time wise, because there's a lot going on for sure. So no, I'm with you on that. And it's just remembering too, like those cut points. I know that there's ways to create productions and like have a good not guess, but like kind of educated guess on where things will land. But we're also then looking at historical information to drive cut points from the previous. It's just a lot of different time zones, like you're saying. So just keeping your head straight on that is probably half, I should say maybe a little less than half of the battle. So no, that was helpful though, a good reference. So I mean, we made it through a lot of questions, and I have one final one for you that I love to ask anyone that kind of joins our podcast too. But to close us out, I know you worked with a lot of different organizations. I mean, you've had a great history at ProspHire as well, and you've seen like kind of what separates those from what can improve, and also from the plans that maybe struggle a little bit more. I guess what's one thing that you wish more health plan leaders understood about like what truly drives sustainable Medicare Advantage star ratings improvement, like for your opinion?
Yeah, I think again, maybe a boring answer, but I think a real truthful one is that stars has just always been an enterprise priority, not just one team's job. It's not just quality. It's not just the HEDIS department. It's not just the stars team. It's everyone in the organization. It takes a collective effort. And again, the best stars programs are the ones who have the people who are curious, tenacious, willing to walk horizontally. To me, that's the takeaway. Stars is an enterprise priority. It takes daily discipline. It takes a constant effort to get a little bit better, close one more gap, remove one more barrier, make one more experience better. That's what sustainable performance really comes down to. An enterprise-wide commitment to doing the work.
Like that. Yeah, and I think too, just making sure, like you said, we have all the right people at the table so that we can make the right experience for the members, and also just make sure that we have the right action plan that can be executed on. But that all comes from what you said as the top priorities. So very good takeaways for our audience. So thank you, Andrew, so much for joining us today. I did want to ask, just for people that are following this or seeing the episode when it comes out, if you wanted to direct them to anything specific regarding like either LinkedIn or a website, because we can actually share that with them too, just in case, and they can follow your work, your team's work, et cetera, in case they're interested in learning more. Anything you would recommend for them to follow overall?
Yeah, we're posting all of our thoughts, insights, analysis, updates on our website, prospire.com. And then certainly I'm posting on my personal LinkedIn. You can look me up. I suppose that I'm just one of those weird people who like reading thousands of documents and dense regulatory language. So I'm always good for reviewing those and giving my thoughts.
I like that. Well, yeah, I like to lean on your thoughts and the others in the industry. It's very interesting to see because it helps, like what you mentioned, looking forward, like helping shape the path of what we're seeing, like with the patterns that are happening in healthcare today and with CMS and all the different lawsuits, et cetera. So I know I've been and will be following you, but hopefully I know others will find this valuable too. This is a huge topic. I know there's probably even more we could have unpacked today, but still, thank you again for joining us. I think one of my biggest takeaways is that this is an enterprise-wide effort. We really do need all hands on deck, but also great cross collaboration, because once we have that, we can really make the member shine when it comes to knowing what type of outcomes we need. And also, how you said, targeting the right person, the right time, and the right way, like the right channel. So all huge, huge things that plans are constantly thinking of. And I think this will be a very valuable conversation for them to listen to. So thank you again for your time. And for those of you that took the time out of your day to listen to this, really thank you, and look forward to sharing more information as we move on in the year. So thank you very much. And thank you, Andrew. I hope you have a good rest of your day as well.
Thanks, Theresa.
Thank you.